Good evening, friends. I am Dr. Vikram Jaggi from Asthma, Chest and Allergy Centers, Delhi and Gurgaon. And today I will be talking about a common skin allergic condition called chronic urticaria. Chronic urticaria or hives, nettles. This is a common skin condition in which the skin becomes red, circular or irregularly shaped raised patches are there in the skin. Let me show you what typical urticaria looks like. This is what typical urticaria looks like. Sometimes you can even write on your skin. This is called dermographism. This is what urticaria looks like. Acute urticaria, which means once in a way this thing happening, is very common on eating something, on taking a medicine, drug, etc. Chronic urticaria is less common but very frustrating. Patients of chronic urticaria have urticaria almost daily for weeks, months, years together. They suffer a lot. For one, they cannot find out by their own thinking, elimination, experimentation, what exactly is causing it. Doctors are sometimes, because sometimes this is a difficult disease to really pinpoint or understand unless there is a specialization in this disease. So because of these reasons, these patients are frustrated and they suffer. What can be done for these patients? First and foremost, we have to find out what you are allergic to. Urticaria is caused by physical reasons and sometimes psychological or emotional reasons also come into play. So let's take them one by one. Allergies. Allergy to certain food items or to certain airborne things, pollens, fungal spore, dust, danders, cat, dog, hair dye. Food items, egg, soya, wheat, chickpeas, rajma, certain fruits, fish. These are the common things which cause allergy to these patients, and once the skin has become sensitized, then triggers like changes of weather, changes of barometric pressure, changes of temperature, in and out of an AC environment, exercise, these things can trigger it off. And once the patient has this problem and is not finding a solution, sometimes he or she becomes so frustrated that that also becomes a factor in perpetuating the chronic urticaria. So the first and foremost thing is to find out what this person is allergic to by doing a skin prick test, in which the allergens are pricked into the skin, either here or on the back, and we can exactly find out what you are allergic to. Finding allergies through blood test is not a very reliable method. Sometimes false positives are there. 40% of the times there are false positives, which means the test is saying you are allergic to such and such food, but you are actually not. So in these situations, you will avoid that food without any benefit. So proper allergy testing is done through the skin prick test. So having found out what you are allergic to, and by avoiding those, and by taking certain medicines which direct the immune system towards the normal side, 70 to 80% of the patients become completely all right over a period of 6 months to 2 years. 20% or so still continue to have it. Now what happens to these 80% who have become all right with a combination of these things? More than half of them will never have this problem again, and around half of them the problem might return after 2 years, after 20 years, nobody knows, either because you have become careless now or you have developed some new allergies. So bottom line is that with this systematic approach of finding out, taking some medication and keeping your mind calm and relaxed, most of these patients of chronic urticaria can be controlled and they can get rid of their problem. Thank you.